Good morning, good afternoon, good evening, and welcome to our IASP Chapters and Federations Town Hall meeting. I'm Greg Carbonetti, IASP's Associate Director of Publications, and today I have the opportunity to facilitate a conversation between our attendees and Andrew Rice, IASP's President, Mary Cardosa, IASP's President-elect, and Steve Gardner, IASP's Chief Executive Officer. We're thankful for everyone who could join us today and remind you that today's conversation is going to be recorded and will be available to view at a later date. When we begin the Q&A portion of today's meeting, there are three ways you can choose to engage with the panel. You can submit written questions via Zoom's Q&A functionality or utilize Zoom's chat feature, or you can choose to raise your hand icon, after which I can unmute your microphone and allow you to verbalize your thoughts. We encourage any and all questions you may have and hope you'll utilize this venue to have your voice heard. At this time, I'd like to introduce our panelists for today's town hall meeting. First, Andrew Rice is a professor of pain research at Imperial College London and an honorary consultant in pain medicine at Chelsea and Westminster Hospital in the UK. He's active in both clinical practice and translational research elucidating neuropathic pain, and his research covers both laboratory and clinical research spanning animal models, through deep profiling of patients with a view to personalized medicine, to clinical trials and evidence synthesis by meta-analysis. Next, we have Mary Cardosa, who's a visiting consultant pain specialist at Seliang Hospital in Sangalore, Malaysia. Mary's done pioneering work in setting up pain services in Malaysia for acute cancer and chronic pain management in Ministry of Health hospitals and primary care settings, and she started the Menang Pain Management Program at Seliang Hospital in 2002, which became a model for group self-management programs in Southeast Asia. Mary initiated the implementation of pain as the fifth vital sign and the pain-free program in the Ministry of Health, and she was involved in planning and running 5 IASP Southeast Asia pain camps since 2011. She was also the key person in the design and implementation of IASP's multidisciplinary pain clinic toolkit project. Lastly, we have Steve Gardner, who spent his career working in and consulting to associations in Washington, D.C., and previously served as an interim executive for several organizations, notably the American Chemistry Council, the National Association of Broadcasts, the American Academy of PAs, and the International Safety Equipment Association. Steve's been with IASP in his current capacity since December of 2023. With that, Andrew, Mary, and Steve are going to share a few thoughts before we open the floor to all of your questions and comments, and we really appreciate everybody being here today. With that, I'll throw over to Andrew to get us started. Andrew, how are you?
Welcome. Thank you, Greg, and welcome to everybody to our second of these town hall meetings, and in particular, welcome to the new global year, which we launched just a couple of days ago, which is on pain management, research and education in low and middle income settings, and you'll hear a lot more about that. I want to say a couple of words about the purposes of these calls. These are to allow the leadership of IASP, in particular Steve, Mary and I, to establish connections and communications with you on a better level than may have been done in the past. We started these town halls with a similar event that was very successful with the major committees of IASP, the working groups and task forces, and now we're doing this with you as chapter and federation leads, and the next one will be with open to the full IASP membership. Anything is on the table. Please, we want to hear all your concerns, and we'll take your feedback back to discussion for further consideration and discussion where necessary. We know there'll be questions about Congress registration dues, membership dues, the various grants we give to members, and also pain camps and pain schools, which is one of our major outfacing activities, and on how we might do better on translating some materials and information. And we really want to hear your views on those topics and what other suggestions you might have. And this will be a regular occurrence to stay in touch with you as the leader of the main aspect of what we like to call the IASP family, that's federations and chapters. Mary.
Thank you, Andrew. Hello to everybody and welcome to this town hall. As Andrew said, IASP is reaching out to our membership, and all of you are leaders of your own chapters and federations, and we want to have better communication between the IASP leadership and the leadership of our chapters and federations. So this, as he said, this is the purpose of this town hall, but we hope that this actually is the beginning of more regular communication between you as leaders of your own groups and the IASP leadership. So over the next several months, you can expect more frequent communication from us with you as leaders of your chapters. IASP is in a transition period after celebrating our 50 years anniversary last year. And we are developing a new strategic plan, and we want you to be part of that, that plan. And we want to communicate with you. We will communicate with you some aspects of the strategic plan and get your feedback on it. So we hope that in all our communications, you will give us the necessary feedback. And we hope that if you do not hear back from us, that you prod us a little, because sometimes things get lost in the cyberspace wilderness. So one of the areas that we are developing is the educational aspects. Well, of course, IASP is very concerned about providing more benefits to our membership. And one of the areas is education. So we would like to have more feedback as well on what kind of content and also perhaps format you would like in the delivery of this educational content. So webinars, so far we have been having webinars on different topics. And this year, as Andrew said, is a global year on pain management in limited resource settings. And we will be having a series of webinars on that. And as you will have seen from your emails, we are, the different SIGs as well as different groups are having different topics as well. And you're all invited to all those different things. But we would like to know what you would want from us. Last but not least, I think that members always want to know when we ask them to join. One of the challenges we have as chapter leaders is that our membership may not be IASP members, because you have to join both the local organization as well as the IASP separately. And so they always want to know what are the benefits of IASP membership. So we would like you to be able to communicate this with them so that we can recruit more membership, because we believe that we do provide a lot of benefits to our members. And but we are always open to more suggestions about how this can be communicated as well as improved. So thank you very much. And I will hand over to Steve.
Thank you, Mary. So the last thing I want to add to this conversation is one of the things we will do more, to be more specific, is we will coordinate more with the chapters and federations on advocacy. One of the things that's coming up is our Global Advocacy Working Group is going to develop a more comprehensive plan for advocacy. I think if you're aware of our advocacy, you know that it's primarily been WHO, and WHO is still an important part of global advocacy. But I think what IASP can do more of is be more of a voice and about important issues, and be more proactive in communicating what the global pain community stands for and the types of things that we would like to see happen. So we want to coordinate with chapters and federations on that planning, so that the Global Advocacy Working Group is taking into account some of the local needs of chapters and federations. And I wanted to explain one new thing that we've just started at IASP. We did this late last year, and I wanted to make this offer to anybody, any chapter or federation out there. Last year, the USASP, the association in the United States, came to us and asked if we would sign a letter that was going around in the pain community. And this was a letter advancing legislation in the United States to collect more data on pain. It was a very simple, very non-controversial bill, supported by both parties in the United States and supported by the pain community. And the feeling was the more signees on the letter, the better. And having the International Association also sign on might be beneficial to the prospects for this legislation. So we discussed this at the executive committee. It's not something that IASP had really done before, but we decided to support it. And the reason being that, and the reason we make this offer to other chapters, we would never advocate in a country or a region just arbitrarily. What was unique about this was the country that was proposing legislation asked for our help, asked us to come in and support them. So we felt like because we were asked to support them, then we should obviously consider it. And then the executive committee, weighed the pros and the cons of this particular piece of legislation. It wasn't terribly controversial. It was something that the entire pain community supported. So it was easy for us to say, yes, we can support that piece of legislation. And then the question was, would we do this for other chapters? And the answer was, well, yes, we should do this for anyone who asks that. We would never go into a country and just sort of randomly advocate our position. But if any country or chapter is working on a particular issue and thinks the International Association, thinks IASP would that our support would benefit their cause, then they can request that. We can evaluate whether or not IASP thinks it's appropriate to be involved, and then if so, offer our support, whether it's signing on to a statement, providing a quote for a press release, or whatever it is that you're asking for support, sign on a letter or so forth. We would be happy to do that if you want it. If you don't want it, because sometimes bringing in international organizations may be detrimental to your issue, then that's fine. We're happy to stay out of it. But we're happy to be more active and more supportive of your individual advocacy efforts if you want it. And that's one of the things we wanted to share that was a little different and a recent development at IASP. So that's essentially our opening comments. And we're ready now to open up the floor to take your questions. Obviously, we're focusing on the dynamics of the chapters and the federations between IASP. You're the chapter and federation town hall, but feel free to offer your questions on any topic that you want at IASP, and we're happy to address them.
Thank you so much, Steve. And thank you to Andrew and Mary as well for sharing some opening thoughts. As Steve had just mentioned, there are several mechanisms for you to ask any questions that you have today. You can utilize Zoom's Q&A feature. And also feel free to drop some questions into the chat. And I do see that we've got somebody with their hand raised in the crowd. If you just give me one moment, I suppose we can start with Avitas. I'm going to allow you to talk right now, Avitas. You should be able to turn your microphone on if you'd like to verbalize your question for our panelists today. I see that you're on the screen with us and you're unmuted, so go for it.
Yes. Hello, dear colleagues. Thank you very much for this opportunity. So this is a very big pleasure for me and all our team because, as you know, we have seen each other in Amsterdam, and this was the first year we became the chapter of the IASP, and that was one of the big dreams of our team. So this year it's more a serious year for us because we decided to pronounce it as Pain Year Campaign 2025 in our country. So we designed a lot of events, separate conferences, joint conferences with different multidisciplinary associations which are connected with pain, but they have all direction and aims and goals. And we decided to do some tabletop exercises, some medical seminars and schools on pain. And the most important thing is in autumn, probably in November, in the start of the November of this year, we want to do the first Armenian International Congress on pain. So I have a lot of suggestions and directions that I want to ask you, because as a real colleague of yours already, I think you know better what you can do. It's better than to suggest you to just to help us. So first direction is to be with us, because in the national level, it's always important in the goodwill and the reputation of the local association when the mother association supports you. And I can for sure say that the last year we had two big conferences. One was dedicated to the peripheral painful neuropathies, and we included all the nosologists there. And in autumn, in very big complex, we had a headache campaign, which we have invited the Professor Jess Olesen, the author of the classification of the headaches. He was in Armenia, and more than 1,000 doctors from all the country have been participated to this conference, which was historical one for Armenia, and which was I think that this was the good example for countries like Armenia for middle income. And I want to say that all doctors from regions were extremely excited to have a chance to listen the lectures from this kind of professional and to join the international one. And IASP was near us. And as you know, and probably you know, the Mr. Andrew Rice knew that in September of last year, we also became the chapter of EFIC, which also had a very huge impact also. So this year, it is very important first. In all our party events, I would ask you to be near us. I don't ask any financial support. I will be happy if you will help us in some kind of, but first of all, to be near with us and to say that we are doing under your authority, under the ISPs. I can send the whole project, all the program for the year, with the titles and topics. And we designed like all the SIGs in IASP, for example, acute pain, abdominal pain. We took the model, and all events will be under the titles in order to have a chance to bring the experts which are ready and every day are working in their part of the work, not to take. And the big conferences should be multidisciplinary to engage a lot of people. There is a huge interest in Armenia because we could, lucky we are that we could make that kind of authority. And I can say that in our association there are 44 members, which whom 28 are the members of IASP. This is a good rate because we don't want to include a lot of people. We want to take extremely interested people. Otherwise, we can have 500 persons in our local association. But the interest of people is really, it does. And I think that this year we want to enlarge. But the first key note for us, a rule, is if you are coming to become a national member, you should be the member of ISP, please, because it opens, the national association could not ever give you the opportunities and benefits that will give you ISP. My suggestion and quest to you is to make an image that ISP is always with the chapters. The second direction is, I have three directions, main direction. One is education. Second one is my question, and I ask you to have a chance to include Armenia in the clinical investigations, because we have a huge amount of patients which can be included in international clinical trials, because I'm not sure we can do a good basic science because of lack of the professionalism, lack of laboratories. But for clinical part, it's really important, and you can have us as a site, and you can look us as a site. And the third thing is to make some joint webinars which are directly addressed to Armenian doctors. This is something psychological. When the SIG is doing something on English and we are participating, I know that but when the event is for especially Armenian doctors, and at least 1 and 2 experts from ISP or by your recommendation are connected, this is psychologically helps, and it can bring for me as a national president to say, you see, ISP is with us, they're supporting us. And the second thing is, yes,
we do appreciate it.
Yes. And the last thing, I'm sorry. And the last thing,
okay.
During these all events, please support us and send to Armenia good experts. And once, please, from the board, I'm inviting all of you, let's visit Armenia once, because we have a lot of work to do with the government, because in different directions in medicine, in public health, we have a lot of things, but no one from paying directly from authorities worldwide from the board ever and never visited Armenia. So this was the last one. I'm so sorry if I
No,
took a lot
it's
of time.
okay, Avitas. We really appreciate it, and thank you for sharing. You know, Armenia is our newest chapter, and they're very engaged right now. And it actually does lead to a few questions that I had for our panelists, if I can kind of expound on some of your thoughts, Avitas, because you touched on a lot of things nicely. And one of them is, you know, your experience in standing this chapter up, you know, some of the resources that IASP is able to provide. And to that end, perhaps we can go to Andrew to kind of build off what Avitas has shared, and that is, you know, what are some of the ways that you've seen, you know, IASP be able to support our different chapters? You know, what are some of the resources that we have that we can offer that perhaps aren't utilized as much by the chapters? You know, ways in which, you know, IASP is able to support chapters. You know, are there things that come top of mind, Andrew, that you'd like to talk about a little bit?
Thank you, Greg, and thank you, Avitas, and welcome to the Armenian chapter to IASP. There are a number of ways in which we can support you. The first is, of course, regionally. Many of the parts of the world are organized into federations. And if I recall correctly, Armenia are now part of EFIC, and I see some of the leadership of EFIC are on the call. So they will be able to do parallel things to us. Just to give you two examples, we produce a number of policy documents from time to time. For example, we produced a position statement on cannabis and pain relief a few years ago. As you've heard already today, Mary headed the effort to develop a multidisciplinary pain clinic toolkit. And all those are available. But the thing I'd probably most like to focus on is during a global year, and we've just launched the current global year, we produce a lot of materials, particularly in the form of fact sheets. And one thing that chapters have traditionally done is taken those fact sheets and translate them into their local language and then disseminate them amongst their local communities. So I hope that was of some information, some help. But the global year is a particular advocacy opportunity for chapters.
Oh, most definitely.
Just to give you for an example, so the Australian Pain Society this year are theming their annual scientific meeting on the current global year theme.
Thank you so much. Mary, you've had obviously a lot of experience working with the pain schools and pain camps, and I understand that that's one way that you know, IASP is able to support the chapters. Would you mind, you know, sharing some thoughts in that regard, or your experience, you know, having been a member of IASP's leadership over the years, Mary, and different ways that, you know, we can support the chapters, or the chapters can engage with us in a way that's productive for both parties?
Sure. Thank you, Greg, and thank you, Avitas. And I think just a comment on your new chapter, and you know that you are small, but more than half of you are members of IASP. I think that's great, and that's a great policy to have, because as you said, IASP, being a member of IASP does give you additional benefits like access to information, as well as grants and ability to and information about programs like pain schools and pain camps. So pain schools, just to clarify, in case it's not clear to everybody here, although I think most of you do know, are more focused on basic science and research, and it's both pain schools and pain camps are for the younger of our membership, and pain schools are for basic science, and pain camps are for clinical, for more focus on clinicians. So that's the differentiation between the two. IASP supports several paint schools. So one is the European, so closest to you will be the European paint school, which I believe is held on an annual basis. And but there is a registration fee, and as I said, it's for basic science. The other paint schools are the North American Paint School and the Australian Paint School, and there's also been one in Latin America, as Patricia will know. So those are the paint schools. Paint camps have been held in Southeast Asia, and have been traditionally hosted by federations. So the Southeast Asian ASEAPS, the Association of Southeast Asian Paint Societies, hosts the Southeast Asian Paint Camp every 2 years. The FEDELAT hosts the Latin American Paint Camp also every other year. And now we are going to have in next month, we're going to have the first African Paint Camp, but we don't have an African federation yet. So that's being hosted by a group of chapters from Africa. So how do you get, so there's no specific, if you're looking at more clinical Avitis, there's no specific paint camp that is targeted at LMICs in the European region or Eastern European region. But we are looking at ways of how to expand the reach of some of the existing paint camps and paint schools. So you have to look out for the call for applications. And, you know, we all go through a very transparent process of application and assessment, review of all the applications by a committee and so on and so forth. And we do target, though, the younger clinicians for the both camps and younger scientists for the paint schools. So I hope that also helps. Greg, sorry, I just wanted to mention one more thing.
Sure.
One more way we can support your educational activities is that we can obviously we can participate as and give, you know, lectures on whatever topics you are interested in hearing, like you mentioned, headache, but if it's not our area of expertise, we can suggest other speakers who may be in the leadership of IASP who could contribute to that. And now I think with the possibility of doing remote lectures, even though you have a conference, you know, you can have a recorded lecture. It's not ideal, but, you know, because of financial constraints, we can help by doing that as well. So yeah, that's all I have to say at the moment.
No, I appreciate it, Marion. Thank you so much. I wanted to kind of stay here for a little bit and switch to Federation.
Great.
But Steve, did you want to add something here?
Yeah, I just wanted to add something real quick. So one of the things we will spend time doing this year, it will take us a while to fully assess. I have a crazy notion that I don't know is workable or not. So we're going to spend time investigating it. Is whether or not IASP can offer services to the chapters and federations that we have not been able to offer previously. That is, I know that a lot of the chapters with less resources struggle with some of the back office functions around, you know, maybe accounting, maybe IT, maybe member databases and member marketing, that sort of thing. So I want to explore whether or not IASP can scale up what we have in a way to support the chapters and give them access to some tools that would, you know, help them with their expenses and help them with their utility in growing membership and communicating with their membership. And I, to be honest, I don't know how feasible that is just yet, but it is something that we're going to explore because I do feel that IASP could do a better job offering direct value to the chapters. We've been very focused on what the value is to our membership, and we can always improve on that. But what value do we provide to the chapters? And some of it is organizing and gathering people together and keeping track of the trends in chapters. And that's great. But we do some of that now. But I know that chapters are sometimes just looking for basic support to help run the chapter, and whether or not IASP can expand what we do to be able to support the chapters is something we're going to explore. And I'm hopeful that we will come through that exploration with offerings for the chapters, but I don't know until we fully scope that out. But that's something that we've been talking about. We got very busy with Congress and didn't really dig into it as much as we wanted to last year. But this year, it's a priority to see if we can figure that out.
Appreciate it, Steve. Can we stay there for just a second? Because it's encouraging to hear that we're obviously going to explore some of these mechanisms to support chapters in a new capacity to the best of our ability. With that said, given the here and now, what's the best way for a chapter to reach out to IASP for some logistical help, Steve? If a chapter had a question about bylaws or membership and things like that, is it as simple as reaching out to the organization, or what do you view as ways that the chapters themselves can interact with IASP and kind of have a transfer of information?
Well, they can reach out to anybody on staff to get to the right person. We have our telephone number and the email addresses that are checked daily that come into the organization. And I know one of the knocks on IASP has been that IASP is not responsive, and that these requests for information kind of go into the void. We've done a lot of work in the last year to address that. And if anybody was frustrated reaching out to IASP, I hope you have a very different experience now reaching out to IASP, because we do pay greater attention to member service and providing answers to folks more quickly than we have in the past. I think we're at a point where we're priding ourselves in our responsiveness. And if you reached out to IASP in the past and were disappointed, we really believe you'll have a different experience reaching out now. So on those kinds of questions, you can reach out to Angelo, you can reach out to me, you can reach out to Latoya. Any of the three of us can figure out the best person in the organization to answer your question or get you to a resource. Latoya Archibald, who is on governance, so she's intimately familiar with dealing with member requests. Usually they're from committees, task forces, etc. The chapters fall under Angelo's group under membership. So he's obviously a first line of defense for reaching out. And then of course, if you want to talk to me, I'm happy to take your email and take your question and figure out how we get it answered. So I multiple ways into the organization to get your questions answered or get access to resources that you think you need.
Oh, appreciate it, Steve. And you actually made mention of something, and I want to go over to Andrew and Mary with this question, because you had made reference to Congress, Steve. And one thing that I've been thinking about in our lead up to Bangkok in 2026, right in Mary's backyard, is the different ways that the chapters and federations can have more of a role in participating at Congress or have a larger presence at Congress. I understand that we're currently in the process of reimagining our Congress program. Andrew, do you want to speak towards your experience, both being at a chapter, at federation level, and now at IASP leadership, as to ways to engage with Congress or offer some thoughts in the lead up to Bangkok in 2026? Anything as it pertains to the chapters and federations, I'm sure we'd be interested to hear.
Yeah. Thank you. I mean, first of all, we've had fabulous. We went to great efforts to get feedback following Amsterdam, and we had a very large number of responses, which were in the main positive. As Greg mentioned, we used the opportunity of our 50th anniversary to constitute a Reimagining Congress task force that has been in deep discussion, and they're going to make a report to council fairly soon. Certainly, I don't think you'll see many things in terms of the overall pattern of the Congress change in Bangkok. but we are very much looking forward to other congresses. We know one thing that was fed back to us and we were extremely aware of was the cost of registration. We do give quite a large number of grants particularly to trainees and registrants from low middle income countries. A particular problem in Amsterdam is we were unexpectedly hit with a 21%, or was it 24%? I can't remember, Steve, tax on our registrations by the Netherlands authorities. That will be much, much lower in Bangkok. I think it's around 6%. So we're already making a saving there. What is also true is it's quite difficult to compare Congress registration fees with those prior to the COVID pandemic, because they're not comparable. The conference centers have been trying to recoup as much as their lost profits from those years as possible. But we are on a par with other similar congresses, but we're still trying to reduce the overall cost. So in Bangkok, we're doing what we can to reduce the registration costs. And of course, hotels will be considerably more cheaper in Amsterdam. The main way of engaging with Congress to submit is to submit workshops and posters. And we already get a large number of excellent workshop and poster suggestions, but please keep them coming. We do record many of the main elements of Congress, and they're now available to you. I think they're free if you registered, and a small fee if you as an IASP member. We probably won't go to a fully hybrid conference in future. There are many barriers to that. But Council will be considering the report of the task force fairly soon. And we'll probably discuss that next month when we're having our council meeting. Registration fees are the main one. We absolutely understand that. We're doing everything we can to reduce them.
Thank you, Andrew. Mary, did you want to offer some thoughts, especially as somebody kind of obviously intimately familiar with the area and everything leading up to Bangkok? We'd love to hear what you have to share.
Yeah, I think the advantage of Bangkok, and Sasikan is on this call, and she is the local arrangements committee chair and president of the Thai Association for the Study of Pain. I think one of the advantages of Bangkok is that it is relatively cheaper in terms of your local expenses. So your hotel, your food, and the food is fantastic, Thai food. So please, even if you just go there for the food, do that. So we encourage you to think about ways of getting to the Congress. One of the things that you may want to, as chapter presidents, may want to consider is organizing groups within your chapter. And then I think we did discuss in the Congress task force, whether we would offer a group registration rate. At the moment, we don't have that as a standard or, but I think that we would be, I hope I'm not overstepping my boundaries here, Steve, but, we could consider, some kind of group. If you organize and bring like 10 of your members, to the Congress, or 10 or more, whatever it is I don't know what the magic number would be. But, the other thing that you can consider doing as federations, I think, is submitting workshop proposals as a federation. So maybe some of the issues that are unique to your federation can be the subject of a workshop, a topical workshop that you can submit for consideration. But of course, there's no guarantee that your submission will be accepted. But I think that we could make a case for giving some weightage to things that are being submitted by Federation. I don't have direct control over this, but these are some of the things that have popped into my head during this conversation that we are having here with leadership of the chapters and federations. Andrew, do you want to respond to that? I don't know whether I'm overstepping or not.
That was all on spot, Mary. The only thing I would say, some people often have questions about how we select plenary speakers, and a lot of care goes into selecting the plenary speakers. And a few congresses ago, when actually I was SPC chair, it used to be only the SPC that could nominate plenary speakers. Now we've expanded that so that the Scientific Programme Committee, previous plenary speakers, and council members can also nominate plenary speakers. So if you wish to nominate people as plenary speakers, you can go through one of those groups of people to make a suggestion. But we do take a lot of care in selecting them, both for the interest in the topic and the ability to speak to a broad audience in a plenary setting.
Thank you, Andrew, and thank you, Mary. And Maria Patricia, we certainly haven't forgotten about you. I was just waiting for the right opportunity to bring it up. Oh, sorry, Steve. I had you covered.
I want to add one thing since we're talking about Congress. One of the things about Congress is that the conversations we had with chapters and federations is at least at Congress is at least part of why we're doing these town halls, because I would like to make the gatherings of the chapters and the federations more meaningful at our next Congress meetings. Right now, those meetings are sort of informational sharing, like, does anybody have any topics to surface? And quite honestly, the value of those meetings has been a little bit limited. Like, we sort of gather at Congress, and a very small fraction of the chapters actually come to the meeting. And I think that's because we don't have a plan for how to interact and engage with each other. We don't have a program in place for how to utilize each other's resources, whether it's, we want members to be aware of something and how to have chapters amplify a message, or whether chapters need support or resources from us that could help them in some way. We haven't built those bridges. And so those meetings are a little flat. They're a little bit, I'm talking about sort of either overall IASP bureaucracy and reporting out, or what's hot at that moment, and they're not as substantial or as results driven as they could be. And so part of this is to engage with the chapters and federations through these types of calls and through other means, provide more value, create more dialogue, create more places of intersection, and create a more meaningful meeting when we are at Congress. I mean, that meaningful meeting is not the end goal, it's the work output. But without those relationships, those plans to work together on specific things, those meetings fall a little flat. And we want to have a better experience when we do get together to talk about these issues. And that comes from having more substantial things to discuss and more points of integration and working together. So that's part of it as well. Sorry, I just wanted to add that.
Oh, please. I'm sorry about that, Steve. I was getting ready to jump into Maria Patricia's question, but that's a great point, and something that I fully support. We should make the most of the time that we have an opportunity to spend with one another in person. And I'm sure that a lot of chapter and federation leaders would look forward to more substantial conversation as we get a chance to convene. But with that, Maria Patricia is the president-elect of our Latin American Pain Society, or rather Federation, which is FEDELAT. And she's speaking in her question here towards the upcoming meeting that they're having for FEDELAT in October in Bogota, Colombia. And it actually is a nice place to segue, because we've been chatting right now in the context of IASP's biannual Congress. But again, our chapters put on meetings, our federations put on meetings, and in Maria Patricia Gomez's message here, speaking towards that, Andrew has confirmed that he'll be present down at their Congress, and having a presence of ISP leadership at our different meetings, and allowing federations and chapters to participate in our task forces and our different programs. And as Mary had spoken to, an opportunity to coordinate different pain schools and pain camps. Andrew, do you want to speak towards, your experience, as our current president, having an opportunity to travel to these different meetings and different ways that, IASP can be present and helpful at our chapter and federation meetings? Anything you'd like to share in this context, I think would be worthwhile.
Thank you, Craig. Hello, Maria Patricia. I have indeed got October in my diary to attend your Congress. I want to make a couple of things about travel or more generally interaction with chapters. So the first thing is we are and have been for the last few years cutting down substantially on the amount of travel that the leadership of ISP do, both for financial and environmental reasons. And we currently have an environmental task force that will look at how ISP manages itself as an organization from that regard. But there are a number of people who still travel and carry the bulk of that word. So each president has a fund where they're able to travel and visit chapters and federations. And that's the sort of, if you like, the ambassadorial role of the president. And that will remain. We have to relook at the budget for that every year. And usually the convention is that ISP will pay the international travel and the receiving chapter or federation will hold will cover the hotel and registration and similar local costs. That's a model that has generally worked for the last 50 years. It is obvious if you want the president to attend something, then you need to ask early because the diary gets full very quickly. So if you want Mary from 2026, you'll be needing to ask her as well. And it is important if we can combine events. We try and, again, to save money and environmental things, to combine as many activities into one trip as possible. So, for example, for ACAPS, their scientific meeting and their pain camp are held back to back, and that's going to enable me to travel to both. I doubt very much that we could travel to the same country for two different events, a camp and a congress, if they were held at different times. There are another group of people who have a travel budget, and those are the federation liaisons to FEDELAT, to SARPS. So FEDELAT is Geordie Miro, to SARPS actually is myself for the moment, and to ACAPS is Fiona Blythe from Australia. They also have a travel budget to visit chapter events and federation events within that region. And those are really the opportunities that are there. You need to approach those people individually. EFIC, for historic reasons, doesn't have a strategic liaison person, since it has been by tradition always the president of ISP. And we may need to look at bringing those into line so that the EFIC liaison has a more strategic role as well. And those liaisons are in place for 6 years, so that they are people who develop a strategic relationship with the region. The only other opportunity for visiting chapters is that once a year, again, at least for the moment, we're keeping it under review, we have an annual council meeting. And one of the main ways we select the venue for that council meeting is the opportunity to interact with the local chapters and federations. So we're going to be interacting with Africa this time. And in relation to the council meeting, we're holding not only the PAIN camp, but also a Pan-African symposium. So I hope that summarizes your question, but say I've recently stepped down as ACAPS liaison, and I found increasingly a lot of my attendance was done virtually. We do a lot of time recording, and the number of visits is probably no more than 2 a year. But those are the mechanisms, but they're continually under review, both for environmental and financial reasons.
Yeah, I appreciate it, Andrew. We're getting close to time here, so I did want to send out one last solicitation. If anybody had any questions they'd like to ask, please feel free. But as we start to approach the close here, Avitas, I see you've got your hand up one more time. If you could keep it short, we'd love to hear what you have to share, but we want to make sure that we're respectful of everybody's time. So I'm going to promote you again really quick, Avitas. you can go ahead and unmute and love to hear what you have to share.
Thank you very much for everything. I just wanted to make some happiness to you, because last year, if you see, we published 2 books. One is dedicated to painful neuropathies and one is to the headaches. And after each campaign we did, because another big problem is the literature, is a national literature, because we have some barriers with the languages, with the qualified literature. So I think we should have a time for that, for further discussions, to have a chance to have more publications in local languages, and also to give a chance for publication, for example, in Pain Journal, and to like a little bit increase the amount of the clinicians and the scientists who are involved, but they don't have any experience of the publishing. So I think that you can make a huge support. Thank you very much for this meeting.
Oh, of course. And thank you, Avitas. And I think that certainly provides another opportunity to, make mention of, our ongoing 2025 global year. And, this is wonderful feedback that, I'd certainly be happy to share with Saurabh Sharma and Margarita Calvo, who are currently the chairs of that 2025 global year task force. So as we come to
Greg, can I just mention something else about every year we have a different global year theme, and one of the things you can do, Avitas, if to see whether your membership is or you think that there are any topics from previous global years that are of interest to your members, and do the translation of the fact sheets, because the fact sheets are actually quite useful in providing information on the various topics. So we have had specific topics like pediatric pain, pain in vulnerable populations and things like that. So you might want to, your committee might want to have a look at these things and see whether you want to translate. Even though they are old fact sheets, they are already still on the website, on the IASP website, and you can always get access to them and do translations and then upload to the website for your members as well. So that's another resource that you can translate. I hear that from you that language is an issue for your membership, and that you want to do, be of service to your members. You can do something like that. So Greg, that's all I have.
Thank you, Mary. I just wanted to give everybody one last opportunity to share some thoughts. Steve, you had spoken towards some things we're going to explore in 2024, and there's an upcoming IASP council meeting where the council is going to get an opportunity to roll their sleeves up and really dive into a lot of topics that need discussion. Any thoughts as we look forward to 2025 here, Steve? And any last things you'd like to share for the chapters and federations, and maybe some expectations as the year rolls on, maybe even in the context of these town halls and communication?
So just 2 quick things. One is, I think ISP as a whole can do better in terms of just communications with members, period. All members, and this town hall system that we've rolled out is one part of engaging there. And it's not just, the channels for engagement and so on. It's what we talk about, how we talk about it, how transparent we are, how much we're willing to dive into difficult issues and that sort of thing. So we definitely want to send that message to membership that there's new energy around having conversations with our members, hearing directly from them. And if members feel like we've not been listening enough in the past, we want to make sure that that we change that perception, that they feel that they can talk to ISP and bring difficult issues forward. Either they don't see us performing the way they want, or they're not getting access to the type of resources they think IASP should provide. We want to know that. And so that's, I guess, the first thing. So I want it to be a new day in terms of communications with IASP. The second thing is, I think some of our activities have suffered from a lack of forward planning. And that's true with just our relationship with the chapters and federations. Like, what do we want to accomplish together? And answer that question proactively and figure out what we can do that's meaningful and helpful, not just activity for activity's sake, but things that our members, our chapters, federations, working groups, SIGs, all of those groups want to accomplish. And I think we need to be, we don't want to be rigid and locked into just, plans that aren't realistic or so on, but we do need more forward looking, more plans. Plans are, I think people forget, a plan is an outline of the activity that you're going to do, but plan is also a communications tool. It's a roadmap for where you want things to go and how you are planned to get there. It's a way to bring people together and rally people around a particular outcome. And so we've missed a lot of opportunities by not structuring our communications that way. And we've missed a lot of opportunities by not structuring our own work that way. And so I think that putting plans in place so that everybody knows where we are on the journey, so everybody knows what the expected outcome is just a way of doing work and a way of interacting with members that we need to be better about. And so this is beginning that journey together. So
Appreciate it, Steve. And thank you, Robert, for sharing some of your thoughts in the chat. We're excited at this new opportunity to engage with our membership chapters and federations in this way. Before I wrap us up, Andrew, Mary, I certainly want to give you an opportunity to share some final thoughts as we look forward to 2025 here. Any parting words that you'd like to share with those in attendance? Perhaps.
I mean, we're very grateful for the fact that you've attended the town hall, and to emphasize Steve's points that whilst communication with chapters and federations may not have always been the best in the distant past, it's very different now, and we always open to receiving queries and questions and suggestions. For those of you in federations, please remember you also have a formal federation liaison, at least the 4 federations that you can go through as well.
Thank you, Andrew. Mary, you want to go?
And what I wanted to pipe in was that, we are actually also, I think that some of the information, the contact information for chapters leadership on our website may be outdated. So you might want to check your own chapter, and we are actively updating everything. So we apologize for the outdated information if it's there, but do alert us. Angelo, as he wrote his email, there is the contact person. And we will make sure that your information is updated, because some people may want to contact you, other chapters may want to contact other chapter presidents. So we are working actively on updating the information. So thanks very much, and thank you for attending this town hall session.
Thank you so much, Mary. And I'll wrap us up now. So, we've come to the conclusion of our IASP chapters and federations town hall meeting. I want to thank once again Andrew, Mary, and Steve for sharing their thoughts today, and of course all of you for joining us. And furthermore, I'd like to share my appreciation for Angela Baselli and Renee Chassie for their help coordinating today's town hall. We plan on holding many more town halls in the future, as we've discussed today, and we'll be sure to pass along information for future convenings as it becomes available. Please don't hesitate to reach out if you have any questions, comments, or concerns. And thanks once again for being here today. Take care and all the best.